Welcome to the Trans-Inclusive Healthcare Series Part 3. In this video, we will go over resources and how to provide appropriate and helpful resources for your transgender and non-binary patients. There are many ways in which healthcare providers can provide resources to support positive health outcomes for trans and non-binary patients. This includes sliding scales, referrals, and recommendations, support groups, help sheets, and assistance navigating inpatient care when in crisis situations. The first thing to consider when providing resources to your trans and non-binary patients is to only create and/or provide materials that are gender affirming to trans and non-binary people. Check out our previous healthcare videos on forms and record keeping and on space for more guidance on appropriate terminology. The link is provided below in the description. The transgender community, like other marginalized groups, faces disproportionate levels of economic disadvantage. This population often has extra health care costs due to the expense of gender-affirming care, which may or may not be covered by their insurance to varying degrees. One way to combat the burden placed on trans and non-binary people is to offer a sliding scale for patients. A sliding scale can give a minimum payment, for example, the least amount that the healthcare could be provided for, and a maximum payment, which may be the full amount of the care. Each client's fee is placed along the scale based on their financial need. By providing the option of a sliding scale, you can make healthcare more accessible to people with limited financial resources. Having a list of providers who you can vouch for as gender affirming and trans competent can be an invaluable resource for your patients. Not only does it make it easier for your patients to access the care they need by giving them a direct list of names, but it allows them to confidently make an appointment without having to worry about being harmed while trying to access care. It is important, though, to actually vet out other providers before including them in any list. If a provider turns out not to be affirming, it could undermine your credibility with your trans and non-binary patients. You can take steps to reach out to your providers to ensure they are competent, and you should also make sure your list is updated on a regular basis. Another helpful resource you can provide for your trans and non-binary patients is help sheets, which are informational documents describing how to do things such as change your legal name and gender marker. You can either create your own help sheets or use some of the informational handouts available online. We have linked some help sheets that we recommend in the description for this video, including some created by our own Trans-ilience research team and some from other organizations such as the National Center for Transgender Equality. Another area where trans and non-binary patients may feel hesitant to seek care or may have concerns about their comfort and well-being is in inpatient care settings. These settings are often gender segregated and may lead to misgendering due to having unfamiliar healthcare providers involved in their care. If you have a trans or non-binary patient who may be in need of inpatient care, you can support them by providing information on what to expect in inpatient settings. Answer questions such as, will it be gender segregated? What is the climate like at that facility? And what can I do if I am misgendered there? May help increasing a patient's comfort and security in seeking inpatient medical care. Lastly, it is vital to continue to provide informational resources for your care team. This will allow your providers to continuously be informed on best practices when treating trans and non-binary clients and allowing them to provide more effective care and useful information to all patients. Check out the description to find out links to resources. Some examples of resources include the WPATH Standards of Care, the ICATH Informed Consent Model, the TransLine Transgender Medical Consultation Service, Yusuf Center of Excellence for Transgender Health, and the Fenway Institute National LGBT Health Education Center. It is also important to remember that other resources and trainings are constantly emerging, so keep an eye out for new opportunities as well. Thank you for watching and for working to make your healthcare practice more gender affirming and trans competent. This has been part 3 of the Gender Affirming Healthcare video series. You are another step closer to having a more inclusive space for you and your clients. Be sure to check out our channel to view the rest of the series.